Good day everyone, we are the Group 1 and we will be discussing about drugs acting on the reproductive system. The reproductive system is a collection of organs and a network of hormone production that work together to create life. The male reproductive system includes the testes which produce sperm, penis, epididymis, vas deferens, ejaculatory ducts, and urethra. The female reproductive system consists of the ovaries which produce eggs or oocytes, fallopian tubes, uterus, cervix, vagina, and vulva. The first drug under the reproductive system is estradiol. The brand name is Estrace. Its drug form, estradiol tablets. Classification, therapeutic, estrogen, pharmacologic, estrogen, antineoplastic. Indication of this drug is the treatment of moderate to severe vasomotor symptoms associated with menopause. Vulvar and vaginal atrophy associated also with menopause, metastatic breast cancer, postmenopausal women, advanced prostate cancer or palliation, and lastly the prevention of osteoporosis. Contraindicated in patients and hypersensitivity to estradiol, angioedema, hepatic dysfunction, undiagnosed abnormal vaginal bleeding, estrogen-dependent cancer, and lastly, thromboembolic disorders. Cautions will be diabetes mellitus, asthma, cardiovascular disease, severe hypocalcemia, and migraines. Drug action of this drug modulates pituitary secretion of gonadotropins, which is the follic stimulating hormone and luteinizing hormone. Therapeutic effect of this drug promotes normal growth or development of female sex organs. Drug interaction. CYP3A4 inducers may decrease the effects. Example drug will be carbamazepine and rivampin. Route or dosage commonly used through PO or orally. Breast cancer PO, adults, elderly, 10 mg 3 times a day for at least 3 months. Osteoporosis prophylaxis in postmenopausal females PO, adults elderly 0.5 mg a day, cyclically 3 weeks on, 1 week off. Vasomotor symptoms associated with menopause orally, adults elderly 1 to 2 mg daily, cyclically 3 weeks on, 1 week off. Adjust the dose as needed. Vaginal cream, which is the estrace, insert 2 to 4 grams a day intravaginally for 2 weeks, then reduce dose to half of the initial dose for 2 weeks, then a maintenance dose of 1 grams 1 to 3 times a week. Adverse reaction or side effects of this drug: prolonged administration increases the risk of gallbladder disease, frequent nausea, skin irritation, headache, vaginal discharge, vomiting, hypertension, and the rare reaction will be or side effects will be cholestatic jaundice, chorea, hirsutism, loss of scalp hair, and the nursing intervention will be monitor BP, weight, serum calcium, glucose, LFT, monitor for lost vision, sudden onset of proptosis, diplopia, migraine, thromboembolic disorder.
Norethindrone acetate, brand name Agistine, drug form norethindrone tablet, classification therapeutic progestin, pharmacologic, sex hormones, indication treatment for secondary amenorrhea, endometriosis, abnormal uterine bleeding due to hormonal imbalance in absence of organic pathology. Contraindication, thromboembolic disorders, coronary vascular disease, carcinoma of breast, abnormal vaginal bleeding, and lactation. Drug action, synthetic progestational hormone with androgenic, anabolic, and estrogenic properties. Mechanism for prevention of contraception unclear. Drug interaction, barbiturates, carbamazepine, fosphenytoin, modafinil, phenytoin, primidone, plerixafor, rifampin, rifabutin, topiramate, and troclitazone can decrease contraceptive effectiveness. Adverse reaction or side effect: breakthrough bleeding, edema, acne, amenorrhea, nausea, headache, rash, allergic with and without pruritus, change in menstrual flow, route dosage, PO, oral, secondary amenorrhea, PO 2.5 to 10 mg. Endometriosis, initial daily dosage of 5 mg norethindrone acetate tablets for 2 weeks. Nursing intervention, monitor for S and S of thrombophlebitis. Withhold drug. Notify physician if any of the following occur: sudden, complete, or partial loss of vision, proptosis, diplopia, or migraine headache.
Raloxifene, brand name Evesta, drug form raloxifene film-coated tablets. Classification: therapeutic selective estrogen receptor modulator. Pharmacologic, osteoporosis preventive. The indication is prevention, treatment of osteoporosis. Reduce risk of invasive breast cancer. Contraindication: hypersensitivity to raloxifene. History of venous thromboembolic events. Women who are may become pregnant. Caution: cardiovascular disease, renal hepatic impairment, unexplained uterine bleeding, elevated triglycerides, and the drug action. Selective estrogen receptor modulator that binds to estrogen receptors, increasing bone mineral density. Block estrogen effects in breast or uterus. Therapeutic effect: reduce bone resorption, increases bone mineral density, and reduce the incidence of fractures. So the drug interaction: cholestyramine reduce peak levels and the extent of absorption. Do not use concurrently with hormone replacement therapy or esosystemic estrogen. May decrease the effect of warfarin. Route or dosage: PO oral or prophylactic treatment of osteoporosis, breast cancer risk reduction, or adults elderly 16 mg a day. And adverse reaction or side effects: hot flashes, nausea, rashes, pneumonia, chest pain, vaginal bleeding, and etc. And lastly, the nursing intervention. Monitor serum total cholesterol, total calcium, inorganic phosphate, total protein, albumin, bone mineral density, and platelet count. Diligently monitor for CV and DVT. Thank you.
So, hi everyone. So, today I will be reporting about the clomiphene. So, the brand name for clomiphene is Clomed, and the drug form for this is clomiphene tablet. And the classification for this is the therapeutic, which is the fertility drug, and for the pharmacology, which is synthetic ovulation stimulants. And for indication, the treatment of failure in the patients with a normal liver function and normal endogenous estrogen, and also treatment of male sterility. And for contraindication, the allergy to clomiphene citrate or any of its ingredients, pregnant women, or uncontrolled thyroid, adrenal dysfunction, or drug. For the drug action, it binds to estrogen, decreasing the number of available estrogen receptor, which gives the hypothalamus to false signal to increase the FSH and LH section, leading to ovarian stimulation. And for the drug interaction, which is not yet been documented, the Clomed have not been yet documented. And for the route dosage, the PO oral, which is the treating, and also a fertility adults with 50 milligram a day with 5 days or menstrual cycle. And for the adverse reaction, which is basometer flushing, visual changes, abdominal discomfort, nausea, vomiting, and also the ovarian enlargement and breast tenderness, and the ovarian overstimulation, and the multiple pregnancies. And for the nursing intervention, which is perform a complete physical assessment and assessing the skin lesions, complete or assess with pelvic breast examination, and also monitor the result of laboratory tests, check the hormonal levels. So that's all. Thank you and have a nice day.
Oxytocin. The brand name of oxytocin is pitocin, and the drug form of oxytocin is oxytocin synthetic. And its therapeutic class is uterine smooth muscle stimulants, and the pharmacology class is oxytocic agent. So the indication of this drug is for antepartum, induction of labor in patients with medical indication, and for the postpartum to produce uterine contractions during the third stage of labor. So the contraindication of this drug is for hypersensitivity to oxytocin, adequate uterine activity, hypertonic uterus, and invasive cervical cancer. The caution of this drug is for induction of labor, fetal distress, hydramnios, and partial placental previa, and predisposition to uterine rupture. So the action of this drug is to activate receptor that trigger increase in intracellular calcium levels in uterine myofibrils and increases prostaglandin production. And it has also a therapeutic effect which stimulates uterine contractions. So the drug interaction is for Cadual block anesthetics, vasopressors may increase pressure's effect. And other oxytoxics may cause cervical lacerations, uterine hypertonus, and uterine rupture. So the route or dosage of this drug is commonly used for through parenteral or IV. So induction of stimulation of liver intravenous for adults 0.5 to 1 milliunit per minute. Abortion intravenous for adults, midterm elective abortion is 10 to 20 milliunits or minutes per minute dosage. So control of postpartum bleeding, IV infusion for adults is 10 to 40 units in 1000 ml IV fluid at a rate sufficient to sustain uterine contraction and control uterine autonomy. For intramuscular adults, 10 units total dose after delivery. So the adverse reaction or side effects of this drug is hypertonicity, abruptio placenta, nausea, vomiting, brain damage, prolonged IV infusion of oxytocin with excessive fluid volume has caused severe water intoxication with seizures, coma, death, and etc. So for the nursing intervention, monitor the blood pressure, pulse, respirations, the fetal heart rate, intrauterine pressure, contractions or the duration, the strength, and the frequency every 15 minutes. And notify physician of contractions that last longer than 1 minute, occur more frequently than every 2 minutes or stop, and maintain careful of input and output, and be alert to potential water intoxication, and after check for blood loss.
Dinaprostone. The brand name is Reproductive. Drug form dinaprostone, gel and suppository. Classification: therapeutic prostaglandin, pharmacologic oxytocic abortifacient. The indication is induced abortion from week 12 through week 20 of pregnancy, promotes cervical ripening in pregnant women, initiation and continuation of cervical ripening in PTS at or near term with a medical indication for induction of labor. Next is the contraindication. Hypersensitivity to dinaprostone, history of difficult labor, acute pelvic inflammatory disease, and renal disease. The caution: cardiovascular or pulmonary disease, diabetes, acute vaginitis, and glaucoma. And the drug action: abortifacient, stimulates uterine contractions, labor induction, relaxes smooth muscle at the cervix. So the therapeutic effect stimulates myometrial contractions in gravid uterus. So the drug interaction: oxytocin may cause uterine contractions, possibly resulting in uterine rupture and cervical laceration. So the route of dosage is through vaginal insert, abortifacient intravaginal, adults vaginal suppository, 20 mg or 1 suppository high into vagina may repeat at 3 to 5 hour intervals until abortion occurs. Intercervical, prepedal, adults intercervical,
Using catheter supplied insert of 0.5 mg into cervical canal may repeat 0.5 mg dose every 6 hours. Intracervical cervidal adults vaginal insert 10 mg transversely into posterior fornix of the vagina remove upon onset of active labor and 12 hours after insertion. So the adverse reaction or side effect, vomiting, nausea, headache, bradycardia, and overdose may lead to cervical laceration. And lastly, the nursing intervention, suppository, cheek strength, duration, frequency of contractions, monitor vital signs every 15 minutes until stable, then hourly until abortion complete. Child monitor uterine activity, record maternal vital signs at least hourly in presence of uterine activity, and reassess Bishop score. Thank you.
Now let's proceed to the next drug, which is the testosterone. Now its drug form, it's either the gel or the solutions. Now for the classifications of the testosterone, for the therapeutic name, it's the androgen, while the pharmacologic name, it's the sex hormones. Now for the indications, it is indicated for the treatments of the delay male puberty, the male hypogonadism, and also it's indicated to the inoperable female breast cancers. Now, next for the contraindications, it is contraindicated to the hypersensitivity to this drug, which is the testosterone, contraindicated to the prostate cancer, the pregnant woman. It also contraindicated to the severe cardiac disease. And if you have a cardiac, hepatic, or renal dysfunction, you must not drink testosterone because it might be worsened. Now, for the drug actions, it promotes growth, development of the male sex organs. Now, for the therapeutic effect, it relieves the androgen deficiency. Now, for the drug interactions, if this drug interact to the other drug, it may be decrease the serum glucose that required for the insulin adjustment. Now, for the route or dosage, it's either through parenteral or topical. Now, for the male hypogonadisms, its route itself it's through parenteral, through intramuscular, and its dosage it's either 50 to 400 milligrams every 2 to 4 weeks, or 75 to 100 milligrams every week, or 150 to 200 milligrams every 2 weeks. Now for the gel, initial dose 5 grams to delivers to 50 milligrams testosterone, and it once applied once daily. It's either to the abdomen, the shoulder, or the upper arms itself. Now for the adverse reactions and side effects, it includes the piliasis hepatitis, the acne, nausea, the pain of IM injections or intramuscular injection site, and skin irritation, etc. Now, for the national intervention, you must monitor the blood pressures, the weight daily, ensure the adequate intake of the protein or calories, and we also monitor the sleep pattern, etc.
Oxandrolone. The brand name is Oxandrine. The drug form of this is tablets. For the classification, the therapeutic is appetite stimulant. The pharmacologic is androgen. The indication of this is an adjunct offset protein catabolism from prolonged use of corticosteroid to provide relief of bone pain for osteoporosis. For the contraindication, breast cancer for male, breast cancer with hypercalcemia for females, hypercalcemia, hypersensitivity to oxandrolone, anabolic steroid or their components. For the drug action, it promotes tissue building processes and reverses catabolic or tissues depleting processes by promoting protein anabolism. For the drug interaction, drugs ACTH, adrenaline steroid, it increased risk of edema, oral hypoglycemic agents. And inhibited metabolism of these drugs warfarin. It increased the risk of anticoagulant effect. The route and dosage it is PO or oral. Tablets for adults, it is 2.5 to 20 milligram in divided doses given twice daily to 4 times a day for 2 to 4 weeks. Intermittent therapy repeated as prescribed. So the maximum of this is 20 milligram daily. Full children, 0.1 milligram per kilogram or less daily. Intermittent therapy repeated as prescribed. The adverse reaction and side effects are depression, insomnia, decreased breast size, deep voice, nausea, vomiting, and etc. For the nursing intervention, it provides adequate calories and protein as ordered to maintain the positive nitrogen balance during the oxandrolone therapy. Weigh patient daily to detect fluid retention. Monitor blood glucose level frequently in patients with diabetes mellitus.
Sildenafil is also known as Viagra. Its therapeutic class is antihypertensive and an erectile dysfunction agent, while its pharmacology class is phosphodiesterase inhibitor. It is used to treat erectile dysfunction, and the contraindication is concomitant triosiguat, guanylate cyclase stimulator, continuous or intermittent nitrate therapy, and hypersensitivity to sildenafil are its components. For the drug action, it enhances the effect of nitric oxide releasing in the penis by stimulation. Nitric oxide increases cGMP levels and relaxes smooth muscles and increases blood flow to the corpus cavernosum, thus producing an erection. Vasodilation causes the pressure within the pulmonary vasculature to decrease. For the drug interaction, the drugs alpha blockers or amlodipine nitrates and other CYP3A4 inhibitors, significantly increasing systemic exposure of sildenafil, increasing risk of adverse reactions. For the route and dosage of the Viagra, it is taken orally since it is a tablet. Men younger than 65-year-old should take 50 mg taken 30 minutes to 4 hours before sexual activity, although best if taken 1 hour. Before sexual activity, decrease or increase as needed based upon response. Those with hepatic dysfunction or severe renal insufficiency or creatinine clearance less than 30 ml per minute, and those taking alpha blockers or potent CYP3A4 inhibitors. For the adverse reaction or side effects, it includes headache, hypertension, blurred vision, diarrhea, seizures, and etc. For the nursing intervention, we need to monitor the blood pressure of the patient, the heart rate, and the rhythm before and often during therapy. We need to monitor the vision, especially in patients over age 50 who have coronary artery disease, diabetes, hypertension, or who smoke, because although rare, sildenafil may cause neurotéric anterior neuropathy that may lead to decreased vision or permanent vision loss. And that's it. That sums up the drugs that affect the reproductive system.